Schizophrenia is a lifelong disorder which disrupts thoughts, speech, and behavior. It affects 1 in 100 people in Australia. Symptoms of schizophrenia tend to appear during the late teen years or early 20s of one's life. While the exact cause is not fully understood, experts believe it stems from a combination of factors. Genetics. A family history of schizophrenia significantly increases risk. Brain chemistry. Imbalances in brain chemicals like dopamine and glutamate. Environmental factors. High stress, early childhood trauma, or drug use during the teen years can trigger the onset in genetically vulnerable individuals. There are 2 main categories of symptoms for schizophrenia. This includes positive and negative symptoms. Firstly, positive symptoms. These alter a person's reality and include the following. Hallucinations. Individuals experience things that don't exist outside the mind, most commonly hearing voices or spirits, but can also include seeing things, like people or animals, smelling things, like smelling smoke or thick smells, or feeling things, like feeling bugs crawling over your skin, or someone scratching you. Secondly, there are delusions. These are strong, fixed beliefs not based in reality. These can include persecutory or paranoid delusions where you believe that you are being spied on, followed, poisoned, or conspired against. Grandiose delusions. Believing you possess exceptional talent, wealth, special powers, or a unique connection to a deity. Delusions of reference. Believing that everyday, neutral events or the actions of strangers hold special personal meaning directed specifically at you. For example, believing that a news anchor is using hand gestures and specific phrases to send secret messages exclusively to you. Somatic delusions. Believing that your body is diseased, altered, or functioning abnormally. Delusional jealousy. A firm, unshakable belief that your romantic partner is being unfaithful, without any supporting evidence. Erotomanic delusions. Believing that another person, often someone famous or of higher social status, is deeply in love with you. Bizarre delusions. Beliefs that are completely impossible and defy the laws of physics. For example, believing that aliens have replaced your internal organs with mechanical parts. The third type of positive symptom is disorganized speech. This might involve incoherent speech, also known as word salad, which is an unintelligible mixture of random words and phrases that lacks meaning. Rapid switching topics, also known as derailment. This is when there is a lack of logical connection between ideas, causing a person's speech to wander abruptly between unrelated or vaguely related topics. Making up words, also known as neologisms. Sound-based association, also known as clanging, where a person selects words based on how they sound, rather than their actual meaning or logical connection. Repetition, also known as echolalia, where a person repeats the words or phrases spoken by someone else. And finally, word approximations, where a person will use conventional words in peculiar or slightly incorrect ways to describe objects or ideas. For example, referring to a hammer as a nail pounder. The final type of positive symptom is disorganized behavior. This can involve unpredictable actions, with sudden, inexplicable agitation, outbursts, or pacing. Goalless activity, starting and abandoning tasks quickly, or carrying out seemingly nonsensical activities, for example, storing pots in the refrigerator. Lack of impulse control, childlike silliness, giggling at inappropriate times, or struggling to maintain basic hygiene. Inappropriate affect, displaying emotions that do not match the situation, such as laughing during a funeral. Catatonia, in extreme cases, a lack of movement, rigidity, or engaging in repetitive, purposeless movements. Our second symptom category is negative symptoms. These refer to a reduction or absence of typical behaviors and emotional responses and include the following. Flat affect. Showing little or no emotion, such as having a blank facial expression, or speaking in a dull, monotone voice. Social withdrawal. Avoiding friends, family, and social activities. Avolition. A severe lack of motivation, making it difficult to start or finish daily tasks. Anhedonia. The inability to feel pleasure or take interest in activities that were once enjoyable. While schizophrenia is a lifelong condition with no cure, it is highly treatable. The right support system can allow individuals to live fulfilling lives,